Hello friends, today we are going to discuss Indian based diagnostic tool for autism which is called Indian Scale for Assessment of Autism or ISSA. Today we are going to focus and we are going to understand the description of ISSA and how it is assessed, what is the administrating procedures, and at last we are going to see one sample, assessed sample, so that this will be the sample so that we can understand and try to implement it wherever we are. Anyways, I'm going to give you the link in the description. You can download from that link and you can implement wherever you are. So let's start and understand what is ISSA first. ISSA is an objective assessment tool for person with autism which works on three modalities: observation, clinical evaluation of behavior, and testing by interaction. So that is very important. So observation, they have to observe directly, understand the behavioral issues, and then interact with the child. And also information can be taken from the parent, from the mother, father, grandparents, caretakers, any other stakeholder who are working for the welfare of children, that particular children. Then it was developed by the NIPID. Formerly it was called NIMH in the collaboration with National Trust, that is Government of India. It was a great initiation and become first autism scale in India, and it can be assessed from 2 year to 9 year plus. Administration time is 20 to 30 minutes plus. We can assess, even it will take more time, depend upon the condition and the environment. So but as per the checklist, it must take 20 to 30 minutes or even more sometime. I think it will take more. So let us understand what are the domains and items given, and we are going to discuss the domains and item individually. So domain 1 talks about the social relationship and reciprocity. So what does it means? See, let us understand first what are the items. Poor eye contact. See, individual with autism avoid looking people in eye. As you know, they are unable to maintain the eye contact as expected for a given age. So eye contact may be unusual, such as a gazing or for too long on the one spot and they are looking sideways. So that is poor eye contact. So because of this, there will be a difficulty in social relationship. Now second item they have given, lack social smile, as children with autism do not smile when meeting people. When you try to interact, sometimes they may not smile, a smile that reflects social responses, they may not show that. So when the child enters, see how they react to the stranger. That is very important when you assess this checklist. So while smile or not, how he responds to the friendly over and just try to shake the hand and just try to understand the smile. Then remain aloof. Yes, children with autism may remain aloof, self-absorbed, withdrawn, not responsive to the other people or environment. So what you have to do, ask the child if he has a friend whom he likes at home, or what he likes to eat. So what kind of things you can ask to understand this. Number 4 is do not reach out to the other person. Yes, children with autism do not react or interact with the other people, so they do not reach the people. So what you have to do is check if the individual with autism take any initiative to elicit or response, or the reaction, so that you can understand whether he reacts to the other person or not. Then inability to relate to people, that is very important. Most of the time what happen, autism do not initiate the contact with other and may not relate to the people as expected their age. So reminder are required to that particular child with autism to that you are present, the social situation, this is there. So you need to just find out what whether they has ability or not. inability to respond to the social or environment. This is very very important. So what happened? Ask if the child behaves appropriately or not in keeping with what is expected in a given social situation. That is very very important because they are not responsive to the social and environment. Then engage in solitary and repetitive behavior. Yes, they like to play solo, so they will be their in own world and they will play again and again, repeat with the same activity. So if the child plays in a group with the other children, or he plays alone with some object, so you can observe and you can finalize your item. Then inability to take turn in social interaction. Yes, children with autism do not comprehend the significance of taking a turn in reciprocal interaction with the other, so they do not wait until their turn comes. So check if the child can play with the ball by taking turn with someone. You just roll the ball, ask the child whether he has going towards the person to catch that ball. So this can be asked or performed to find out whether the child has ability in a social interaction or not. Then do not maintain peer relationship. Yes, children with autism do not develop the age appropriate friendship. It might be apart from their age, they may not engage in their age appropriate. So ask if the child plays with the children on his peer group, or what he plays them, how well he mixes with them, so what kind of bonding they have. So that can be, the information can be taken by the child itself, by observation, or from the parent, or directly interacting with the child. That's why I told you three modalities is very very important while doing this assessment. Let us see domain number 2. It is emotional responses. Now here, inappropriate emotional responses. The person with autism do not show the expected feeling in social situations, so they express inappropriate emotional responses like laughing when you scold, when you shout. So their emotional is not appropriate. So they may have some difficulty. So in that way you can just take and find out whether he has inappropriate emotional responses or not. And then social exaggerated emotions. That's very very important. A person with autism may show anxiety of or fear, which is excessive in nature, which may be triggering of without apparent reason. So the autism individual may show extreme fear of an object, of an event, or uncontrolled behavior. So make sure that that's very clearly emotionally observed. Engage in self-stimulating emotions. Yes, children with autism may engage in self-talking, that is inappropriate of their age. For example, a 15-year-old autism child and behavior like a 10-year where he's playing. So there will be a lot of self-engagement without any reason. So check if the child talks to the self or laughing. You would have seen number of times. These are the typical characteristic which is seen in autism actually. Then lack fear of danger. Yes, a person with autism may not show a fear of hazardous or any danger which are the same age the child does. So that is also one characteristics. Excited or agitated for no apparent reason. Yes, that is also there. So children with autism may show excitement, overactivity, or agitation that is both excessive, unwarranted. So child moves around with a huge energy, may have difficult to control. So that kind of things you can observe. So let us go to the third domain, which is about speech, language, and communication. So here, acquired speech and lost. That means at the some part of the age, child was talking and then he lost subsequently. That's why what happened, 50% of autistic may be non-verbal. They do not speak because of that. once acquired and lost. So you need to assess very clearly whether he has any history of acquiredness of speech or not. And then difficulty in using non-verbal language or gesture to communicate. So here children with autism find it difficult to express their needs even with the gesture. They may show different signs which is not able to understand. So sometimes they drag, they pull their clothes, with their of their mom, so that they can understand they require something. So that is what you need to understand and give the intervention. Engage in stereotype and repetitive use of language. Yes, so here what happen is children with autism may repeat a word, phrase, sentences out of context. They repeat the same statement many times, so you need to check it out. Then engage in echolalic speech. Yes, see, echolalia, it's very clear, it bounce back. That means whatever, if you ask the name, what is your name, he will also reply what is your name. So that is echolalia. Make sure that you ask such questions and then you can go further. Produce infantile sequel or unusual noises. Yes, children with autism may sequel make different noise. It is unintelligible speech which may produce speech like sound, so which is not clear actually. Then unable to initiate or sustain conversation. So that is very very important. That is very very important. Unable to initiate, that means children with autism may not be able to initiate or sustain the conversation with others. So what I have to do is check if the child can meaningfully respond to a series of questions or maintain a dialogue for adequate time. So that you need to check it out. Use a jargon or meaningless word. Yes, that means person with autism use strange or meaningless word which conveys no meaning at all. So you need to just check it out that. So number 22, use pronoun reversible. That means if I say I, they will say I for you, you for I. So that kind of pronunciation they may have, that is a frequent difficulty they may face. And then we have unable to grasp the pragmatic of communication in the real meaning. So what we have to do is, here, a person with autism have difficulty in understanding the true intent of speech of others. So they may not understand a pragmatic speech communication. For example, when somebody asks them, can you tell the time, they may say yes and then stop. So check if the person understand the humor, that kind of things you need to check it out in speech and language communication. Let us see number 4, that is about behavior pattern. Now here engage in stereotype, that means here engage in stereotyped and repetitive motor manner. That means the person with autism may engage in self-stimulatory behavior in the form of flapping hands or fingering, body rocking, using an object for their purpose. So that kind of things, that means a motor manner, repetitive behaviors you can see. Show attachment to inmates objects. So here individual with autism may be attached with certain objects like some pen, stick, toys, bottles, and they want keep all the object and check if the child shows the attachment to that object or not. Then you can identify this. Then show hyperactivity and restlessness. Yes, individual with autism may restless with boundless energy, which make it difficult to control, which is very difficult to control at the later stage. Exhibit aggressive behavior. Yes, they do show. So person with autism may show unprovoked aggression, socially inappropriate behavior like hitting, kicking, pinching, this kind of behavior you can see. Throwing temper tantrum, this is the main common behavior which you can see, like a head banging, screaming and yelling. This behavior happen when the child is frustrated. Engage in self injurious behavior, yes. So a person with autism may indulge with self injurious behavior like biting himself, hitting, then or some other tapping on the table, or showing some sort of self injurious behavior for their needs. Insist on shameness, yes. So here children with autism may resist change in their routine. So if you change the place, he may get frustrated. So check if the child want to sit at the same place, read the same story, read the same book, sit on the same table. So all these things you need to identify. It should be same. Okay, so let us move to the fifth domain, which is called sensory aspects. In this they have given some items. Let us discuss that. Unusually sensitive to sensory stimulus. So person with autism may react strongly to a certain sound, lights, touch, taste. uh, so what happened, you can ring a bell to make sure that whether child is responding. That is auditory, sensory. So check if he is finding the sound aversive. So all these things you can do to find out. Stare into space for a long period of time. That means the person with autism may see one spot for a longer time. Okay, they seem to be unaware of surroundings, so they are not unaware what's happening around him. Difficulty in tracking objects. That means the person with autism may have a difficulty in tracking the object or a person in a motion. When some, for example, when someone is moving, where he is going, in which direction, he may not able to track that. So what you can do is throw some ball or a rattle on the ground and ask the child to track it where it gone. So in that way you can just track it out. Has unusual vision, yes. What you cannot see, they can see. Correct. For example, if you give a toy to a autism child, and what happened, they don't think that they are looking, and if they are staring for a long time, and you think that why he's staring, but he's not staring the whole object, he's staring a small fine point at the car which you cannot see. So that is how they do. So check if the child is looking at the same part of the object or a toy, watching from long time, so that you can understand the level. Insensitive to pain, yes. So person with autism may hardly react to the pain. They seem not to be distressed or cry when hurt. So they seems to have a high threshold for pain, so that you need to remember. Respond to objects unusually by smelling or touching or tasting. So that is very important. Individual with autism may go around exploring their environment by smelling, touching, or tasting objects. So keep all the objects and observe if the child smell, touch, taste the objects, and if he is using the objects appropriately. So that you need to find out. Let us see another domain, which is called cognitive component. Without this, any activity cannot be performed. So inconsistent attention and concentration, yes. So you can ask the child to put the peg on the board and sort out the pieces from the jar. So in that way you can find out whether the child has attention and concentration to the activity, how far he sits in the activity. So in that way you can assess. Delay response time, yes. If you ask some question, then they may not able to respond immediately. Why this is happening? Because of brain processing. So quick response will be not there. They will take a longer time to respond to your question. Unusual memory. Yes, person with autism may show memory for thinking, which most of the individual would have forgotten. So you may not remember, but he will remember the whole scene. So check if the child recognizes the people which he has met long time. So in that way, you need to just identify. And the last one is your savant ability. That means the unique ability that the child has some artistic talent in his or not, that you need to, whether in dancing, music, violin. So lot of things are there which you can observe in savant abilities, and then you can assess. So these are the domains, 6 domains which we have discussed. Okay, so let us see the guideline for testing the administration. So each item of ISSA is to be assessed and rating is to be given based on intensity, duration and frequency. See, intensity means severity level, duration means how many minutes, hours he is doing that undesirable behavior, and then frequency, out of 10 how many times it is happening. So in that way you can find out and you can rate. So you need to remember 2 things in that. One is testing condition. Whenever you administer the test, make sure the person physiological condition is quite good. He is not fatigue, sleep or state changes. He is comfortable of the person being tested, who's testing, whether he's comfortable with it or not. He is not getting fear of that test. Quality of informant is verbalization, those who from where you get the information. Consider the environment and cultural influence as well. Then build the rapport while interviewing. Understanding individual differences is very important. Familiarity with the test and content procedure. As a special educator, as a psychologist, you must understand thoroughly to identify or to assess the client. Yes, flexibility of examiner also is very important to deal with it. If not, it will be so tough to assess. Then second one is your method of assessment. As I said, 3 modalities you need to remember: observation, informant, interview, testing of the child. So what are the materials used in this? Let us see. These are the materials which you can see. Without this material we cannot assess. So we need to be ready with this 24 material which is mentioned in the tool very clearly. It can be easily taken from anywhere. This you can get in the market as well. You can prepare and then you can assess. Then scoring. Each 40 test item is to be rated on 5 categories, out of which one is to be checked. Okay, see what are the 5 categories? Rarely, sometime, frequently, mostly and always. See, rarely you have to score 1, sometime 2, frequently 3, mostly 4, always 5. These are available in the checklist very clearly, you can understand. And the minimum score is your 40 and maximum score is your, you can say, 200. So that means 200 into 5 is your, sorry, 40 into 5, that means 5 categories, that is 200. So maximum is 200. So let us see the norm of ISSA for diagnosis. For example, after assessment, if you see the child is scoring less than 70, that means the child is normal. Okay, let us say if the child scores 70 to 106, that means the child is mild autism. If child score between 107 to 153, the child is moderate autism, and it's above 153 severe autism. So these are the norms which you have to follow to tell that my child is normal or too severe. These are the percentage of disabilities which you can see. This is very clearly, if it is 70, that means child has 40% of disability. As per norm, at least we must have 40% of disability to categorize. Now let us see the checklist. So here you can see, well, here you can see, as I said, you in the direction it is very clearly written, all 40 statements need to be divided into six domains, which divided into six domains, which I have already explained. And then the scoring from rarely to always, from 1 to 5, and then you know and then you have the rows and columns where you need to find out. For example, let us say we will take example, has poor eye contact. So you need to score each and every item. You should not leave even single, as it is very clearly mentioned. So you need to be very clear. Let us, so if you have a if you're watching this, just what you can do is you can just tick. Okay, let us understand this. Well, if you're not able to see, then if I'm doing it, if you're not able to do it, you can just download it and then you can practice. Just you have to tick check mark. So check mark. Okay, so which is very important. Without this you cannot score it. So what I have done is, now I have just checked marked almost everything now. Yeah, so once you have done, then you have to score it. Let us say I have check marked rarely. That means how many question I have check marked? 1 2 3 4 5 6 7 8. That means 8 into 1, that means 8. In rarely 8, I have scored 8. And then in the score 2, 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20 21 22 23 24 25 26 27 28 29 30 31. So 31 into 2 is how much? You have to calculate it. You can calculate it with your calculator, so that there is no mistakes. 31 into 2 is your 62. So 62 in second column, you have scored 62. He has scored and in column 3 just 1, that means 3. So you have to calculate all. 8 plus 62 plus 3 is your 73. That means here, second column of your classification, 73, the child has scored 73. That means child has mild autism. So this is how you score. I think it is clear to you all, the whole process of understanding of Indian scale, which is called Indian Scale for Assessment of Autism, or ISSA. And I hope, if you have any doubt, and I hope you will you will download and try to understand thoroughly. And if you have any doubt, you can just let me know. We will try to make sure clear all the queries. So till now, I think we have covered all the things, almost all the things. So I think we haven't left out anything. Okay, then see ya. We will see the next time. Bye bye.